to the week 4 of this course on ACL injury rehabilitation. We will be covering the intermediate phase of rehabilitation during this week. Lecture 16, Core and Hip Stabilization Techniques to Support the Knee Function, addressing the proximal kinetic chain. I am Dr. Jerin Shaji from the Department of Sports Medicine, Armed Forces Medical College, Pune. In this lecture, we will be elaborating on the importance of core and hip stabilization to support the knee function during the rehabilitation process. The learning objectives of this lecture are to understand core, hip and knee biomechanics, to highlight the importance of lumbopelvic stability in ACL recovery, to focus on hip abductors and external rotators strengthening, to discuss various exercise progressions for core and hip stability, and also to see how to integrate them into ACL mid-phase rehabilitation. Coming to the introduction, what is the kinetic chain of movement? Your body is made up of many connected parts like bones, joints, muscle, and the fascia. They work together like links in a chain or like gears in a machine to create movement. When you move one part, it affects all other parts. For example, when you swing your arm while walking, the motion starts from your legs, moves through your hips and core, and finally reaches your arm. This connected system of parts working in sequence to produce movement is called the kinetic chain of the body. Consequently, if one part of the chain is weak or injured, it can adversely impact the whole movement and potentially lead to injuries. So, for smooth performance of a task, all the links in the chain are to be strengthened. What do you mean by the core of your body? The core of your body is a dynamic structure which consists of group of muscles in the middle of your body that help to support and stabilize the spine and pelvis. They work together like a strong box or foundation block for everything you do. It can be described akin to a box with 6 sides, as you can see on the image. The roof consists of respiratory diaphragm, which is the most important breathing muscle of your body. The front portion consists of abdominal muscles, commonly known as the abs. The both sides consist of obliques muscles along your flanks. The back consists of muscles in your lower back supporting the spine. The floor consists of muscles of your hips, pelvic floor, and your buttocks. A strong core is indispensable towards maintaining good posture, balance, and in preventing injuries. What is the role of hip stability after ACL reconstruction? The hip muscles are essential for walking or running gait with different roles for each group of muscles. The hip flexors drive forward leg movement. The hip extensors take the thighs backwards and stabilize the pelvis and control forward momentum of the body. The hip abductors and external rotators take the thighs outwards, preventing the pelvis to drop while walking and by stabilizing the hip during single leg support. These muscles work together in concert to maintain balance, support the body's weight, and to provide the necessary force for both propulsion and smooth coordinated movement of the lower limb during walking. Adding isolated hip strength exercises such as hip abduction, extension, and external rotation to standard ACL rehabilitation improves hip muscle strength and balance of the body. This promotes enhanced single leg control and neuromuscular function, both critical for functional recovery and prevention of further injuries. Early introduction of hip strengthening exercises post ACL reconstruction is recommended. Now coming to how to progress on exercises for core and hip stability. The goal here is to restore the lumbar spine and pelvic control, hip strength and stability to protect the knee during athletic tasks. Coming to the progression of the exercises, we should progress from static to dynamic to functional and sport specific activities. Also progress from bilateral, which is both sides supported, and unilateral, which is single side supported loading. Progress from stable to unstable surfaces. Start with low loads and progress to higher loads or power based activities. How to improve your core stability for enhanced trunk control and stability against extension and rotation forces. These exercises ultimately restore lumbar and pelvic stability to reduce stress on the healing ACL graft. The static stability exercises are front plank, side plank, dead bug, and bird dog exercises. Now let's see each of these exercises. The front planks. The body is held in a straight line, supported on forearms and toes, engaging the abdominals and back in a straight line. For beginners, knee planks can also be done. Now coming to side planks, by supporting the body on one forearm and side of the foot, target obliques and hip stabilizer muscles. Coming to dead bug exercises, this is a supine lying core control exercise where opposite arm and leg are extended while maintaining core activation against the floor. The bird dog exercise. It's a quadruped exercise where you start in the tabletop position and the opposite arm and leg are extended outwards, promoting trunk stability, balance, and hip control. Let's progress with core exercises for rotational stability to reduce stress on the ACL. These anti-rotational stability exercises are Pallof press and rotational Pallof press. Coming to Pallof press. It is an anti-rotation core exercise where the individual presses a side pulling resistance band or a cable straight forward from the chest and resisting rotational pull. Coming to the rotational Pallof press, it's a dynamic variation where the person rotates the torso and arms against the band or the cable resistance, training for controlled trunk rotation and stability. How to strengthen the hip extensors, which consists of gluteus and hamstring muscles. The goal is to improve posterior kinetic chain strength to reduce anterior tibial shear forces on the healing ACL graft. We shall progress from static, which is at rest or stable position, to dynamic in movement and towards functional exercises. The static exercises are supine glute bridge with resistance band around knees. The dynamic exercises are hip thrust and hip thrust march. Coming to supine glute bridge. It is performed while lying on the back with knees bent, lifting the hips upwards to activate the gluteus and posterior chain muscles. Coming to dynamic hip extensor exercises, the hip thrust.
1,
It is a
2,
glute dominant exercise where the upper
3,
back rests on a bench and hips
4,
are driven upwards against body weight,
5. Stop.
even including load. Now coming to an advanced glute bridge march. It is a single leg variation of the glute bridge performed alternately, enhancing unilateral or single-sided hip stability and glute strength. Similarly, a hip thrust march also can be performed using a bench. Now we will progress to functional strengthening of hip extensors. This consists of step-ups with hip drive and single leg Romanian deadlift. Coming to step-ups with hip drive, the person has to step onto a box or a platform and powerfully drive the opposite knee upwards, training for hip flexion and extension with explosive.
Start.
Coming to single leg Romanian deadlift, it is a balance and strength exercise performed by
Start.
hinging at the hip on one leg while extending the other leg backwards, targeting
Start.
glutes, hamstrings, and core stability. How to strengthen the hip abductors and external rotators, which consists of gluteus medius, minimus, and piriformis muscles. The goal is to control the femur bone movement, which is critical in ACL protection. We will progress from muscle activation exercises to dynamic control exercises and functional movements.
Start.
Coming to muscle activation
1,
exercises. The side-lying hip abduction exercise.
3,
It is performed while lying
4,
on the side, lifting the top
5.
leg upwards
Bas, relax.
to activate the gluteus medius and to improve lateral hip strength. Side-lying hip external rotation. The person has to lie down on the side with hip and knees flexed. Lift the knees upwards and outwards while keeping the foot stable. Progressive overload can be provided by adding graded color-coded resistance bands. Now for dynamic control, perform lateral band walks and monster walks. The lateral band walk is a resistance band exercise performed in semi-squat position, stepping sideways to strengthen gluteus medius and external rotators. The monster walk is a band resisted diagonal stepping drill forwards or backwards that trains the hip abductors and external rotators during functional movement patterns. Coming to advanced hip abductor and external rotator strengthening exercises, which helps in further improvement such as chair squats and Bulgarian split squats. Coming to squat to chair exercise, it is a controlled squat performed to a chair or a box targeting the hip abductors, gluteus and the quadriceps muscles. You may progress from both legs to single leg. Coming to the Bulgarian split squat. The split squat with rear foot elevated and kept on a bench or a cot and lowering the body to squat position. This trains your abductors and external rotator muscles. Take note of these points while integrating these exercises into the ACL mid-phase rehabilitation. The exercises are to be done in repetitions starting with about 5 to 10 repetitions and in sets of 2 to 3 at a time and up to 3 to 4 times in a week. Always ensure neutral spine and pelvis alignment. Avoid compensatory movements like hip drop, trunk lean, and the valgus collapse of the knee, which is inwards or outwards collapse. Integrate visual feedback using a mirror, video, or app-based techniques to enhance motor learning. The progression is criteria-based and not time-based. Therefore, the individual must demonstrate control and stability before advancing further. Let's summarize the role of core and hip stability post ACLR. Core stability significantly impacts the outcomes after ACL reconstruction by improving functional recovery, by improved neuromuscular function. It has been found that 8 weeks of simple core stability training has shown to increase core muscle endurance, hip abductor and external rotator strength, to optimize knee movements, especially during dynamic tasks like single leg landing. Reduced re-injury risk. Deficits in core stability are linked to abnormal lower limb movement patterns, especially increased knee inwards angle or valgus angle, which is identified risk factor for both primary, that is first time, and secondary or repeated ACL injuries. Core stability exercises help control lower limb movement patterns, lowering re-injury risk after ACLR. Gait and balance improvements. Core stability training also results in improved walking or running gait patterns, body balance, and overall coordination in ACL patients, contributing to better outcomes and daily function. Integration into rehabilitation. It is recommended that core stability exercises be incorporated into both post-operative rehabilitation and ongoing warm-up routines, even after the athletes return to play. These exercises are time efficient and practical for regular use. The take-home messages are: early introduction of core and hip strengthening exercises during ACL rehabilitation leads to better dynamic balance and better functional outcomes to reduce re-injury. These are my references. Thank you very much. Jai Hind. Jai Hind.